What's going on, guys? Good morning. Tony Maritato here, physical therapist, and today I want to talk about using the massage gun and some different positions for knee flexion. So let's say, for example, I had a total knee replacement on the left. What we want to do, everybody understands the importance of flexion, straight linear flexion, and extension. But the hip and the ankle are going to influence your knee mobility quite a bit. And so one of the things that I like to do, especially for those of you who are dealing with a little bit of hip tightness, maybe some sciatica issues, which isn't uncommon after a total knee replacement, is to work on including hip rotation. So this is lateral, external hip rotation, while I'm working on knee flexion. So basically, if this was my bed, I'm gonna sit sideways on the bed, I'm gonna put my foot on the floor, the surgical side is up on the bed. And what I'm doing is I'm getting into this position about 90 degrees. If you don't have 90 degrees, that's fine. Maybe it's 80, 85 degrees. But as my knee flexion improves, I work that ankle in closer to my body. That's increasing the flexion through the knee. But I'm also working on the lateral hip rotation. Now, if this in and of itself is beneficial, it's even better when we throw the massage gun into it. So what I like to do for most of my clients, they'll develop some medial, some inside lower leg pain. The muscles of the lower leg will get sore just because they're walking and doing more than they used to before the knee replacement. So I'm going to kick the gun on. And basically, while I'm in this knee flex position, I'm just allowing the gun to work not on the shin bone itself, but on the muscles directly behind the shin bone. So that's going to be the soleus, the gastrocnemius on the medial side. I can also spend a little time working on the inside of the knee. Typically, when your surgery happens, they do a superficial incision through the skin, which is down the center of the knee. But then there's an internal incision that goes around the inside of the kneecap. So many of my patients will talk about just discomfort, numbness, tingling, altered sensation on the inside of the knee. The massage gun is really great just to kind of give you some other sense of stimulus. And so I'm working through this. As I feel like my knee loosens up just a little bit, I'm going to bring it in a little bit more. I'll spend a little more time. Typically, I'm going to look at being in this position for 2 to 3 minutes. And then what I'll do is I'll go ahead and turn the gun off. I'll let the knee go back into extension. Now I'm telling you, commonly, after I do 2 to 3 minutes in flexion, it's gonna feel uncomfortable to go into extension because what's happened is the connective tissue is kind of adapted to that flex position, and now we're going the opposite way. But this variety, going from flexion for a prolonged period to extension for a prolonged period back to flexion, it's an important motion because that is basically when you've been sitting in a chair for a while and then you get up to go. Many clients will talk about stiffness in the joint until they get moving, until they get walking. We want to work on that. We want to work on that transition from bent to straight or straight to bent. So going back and forth, if you have the massage gun, awesome, use it. When I'm in extension, I can do the same thing. This time what I can do is I can kind of work the lateral aspect of the knee. I can work the IT band. I can come up here into the hip just a little bit. And then when I'm ready, 2-3 minutes of extension, I come back into flexion and I give myself a little bit of overpressure. So what we call it, enough that you feel the pull, not so much that it's painful. We need a position that we can comfortably sustain for 2 to 3 minutes because the connective tissue is going to take time to open up. It's a term we use called creep, where basically when we put tension through the connective tissue for a sustained period, eventually that connective tissue will start to lengthen and start to accommodate the new position. So guys, I hope that was helpful. If you're looking for one of these little massage devices, I've got some links down in the description. They're available on Amazon. They're available just about everywhere these days. But post your questions in the comments. Let me know how I can help. Otherwise, I'll catch you on the next video.